Well, Pfizer and BioNTech now asking the FDA to authorize emergency use of their COVID vaccine for kids ages 5 to 11. The company is submitting the data to support the request, and we're hearing the FDA could approve the move sometime between Halloween and Thanksgiving. Now, the FDA will first have to decide if the shots are safe and effective for kids before that decision is made, and it brings up a lot of questions for parents and for caregivers. So joining us right now to answer some of those concerns, Dr. Jody Terranova, a pediatrician with UConn Health. Thanks so much for joining us this afternoon.
My pleasure to be here. Thank you.
So if things go well with the FDA, we know the CDC is still going to need to approve this. So realistically, when could kids ages 5 to 11 begin getting shots if all goes smoothly?
I think we'd be looking at that first week of November because we know the FDA meeting is going to be October 26th. And then traditionally the CDC group, the ACIP, meets a couple of days after that to review and make their recommendations. So probably that right around Halloween time, what we've been saying, that first week of November would be our best case scenario.
All right, we know we've seen a spike in infections with this Delta variant, but there are some people who say, hey, look, kids aren't necessarily dying from COVID. Why get the vaccine? What do you tell patients who ask that?
Sure. So, not dying is great, but that's not the only thing we want to prevent. We have seen kids get sick with COVID, and we have been seeing kids get the long haul syndrome that adults were getting, where they have kind of the months later still with fatigue and brain fog. And our local children's hospital has opened up a clinic for that because there has been an increased number of children affected. So, even though children aren't as severely impacted as adults, they are still being impacted.
All right, Dr. Jody Terranova with UConn Health, thank you so much for your time. Appreciate it.
Thank you.